from Florida's Gulf Coast, where sun-kissed waves inspire us. Thank you for joining us for this episode of Talent Talk and Strategy Stroll, where we navigate the intersection of talent optimization and business strategy with wit, wisdom, and a dash of sibling rivalry. I'm your co-host, Mary Stockwell, joined by my brother, a Hemingway lookalike, and a seasoned business and mental fitness coach, and a talent optimization and workforce strategist, Tim Stockwell. How are you, Tim?
I'm doing great, Mayor. How are things up your way? Rainy today?
Actually, it was scheduled to be rainy, but no rain.
No?
Yeah.
Good. I think
No
they
rain.
got it lower Florida, and we didn't get any.
Oh, yeah. Well, they were predicting big rain, but maybe it's coming tonight.
Yeah, we'll see.
So today in our Roots Run Deep segment, we're celebrating our sister, Jerry Ann. She is a member of our advisory board, Emeritus Advisory Group, a fantastic sister and a great friend. She often hosts guests on her party porch on Clifford Lake in Stanton, Michigan. And that is how we were introduced to our guest today. So Tim, do you have some funny stories of Jer when she in her childhood or even today?
Yeah. It's funny to us today, I think, as I reflect back on this moment, but it gives a little insight into our rather chaotic youthful age when growing up, and we did in Westland. I remember one afternoon after we were ice skating, I think, at Hines Park, and we were all loaded in the car, all six of us, or maybe more. And as my mother pulled out onto the road, the door opened, and Jer was sitting right at the door, and she fell out. And before she hit, I just instinctively reached over, grabbed her hair, and jerked her back up into the car. And she was as if nothing had happened, just like, oh, that's an everyday thing, no problem. But she was very close to just being crushed. But we laugh when we talk about that today because it just reminds us so much of the chaos of our life. So,
And the station.
The fact that we brought that one up this time.
Yeah. Fun memories that I have, and I think it still resonates today as to who she is as a person. She would, I think she was like in her early high school years, and she was a cheerleader. So she'd be doing cartwheels all over the lawn, and she'd be, doing her pom pom thing and be aggressive. BEAGGRESSIVE, be aggressive. And I mean, I remember it all the time. And I mean, because she would say it constantly as she was doing these flips, and me, I'm not really super limber. So to be able to see her do that was just, and it still, flashes in my mind, and it's really funny. So we haven't introduced our guest today, but David does know Jerry Ann, so I bet he might have a couple funny stories.
Well, he could. So let me just do a real quick introduction because, on this episode, we're going to sit down with our sister's neighbor, who resides there also in Illinois, Dr. David Duffy, who's Vice President of Women's and Children's Services at OSF Healthcare. He's a pediatrician, dedicated healthcare leader, shares his insights on how the pandemic has impacted the most vulnerable members of our community, the women and children. And then we're going to delve into the challenges of some of the staffing shortages, the rising costs, supply chain disruptions, and explore Dr. Duffy's strategies for healing and rebuilding in a post-COVID world. David, thanks for joining us and welcome to the pod. How are you?
I'm delighted to be here, doing very well today. It's very sunny and in the 90s in Illinois, where I'm sitting today. So
wow,
more like it ought to be for you guys down there. And yes, I have been a guest on the party porch at Clifford with Jer, and I think that what we will do is I'm going to remember the be aggressive, and maybe we'll do some cheering on the porch with a couple of margaritas.
That's right.
Oh yeah, make sure you get her to do the cartwells too.
That you have to record that though, because we will all have to see that one.
Yeah. Well, I'll be heading up there this weekend, and I'll bring it up. So.
Well, great. Safe travels to you then.
Yeah. Thanks. Well, great. I am am delighted to be here today. And so thanks for having me. And
Sure.
yeah,
Love
the
to have you.
pandemic was really well, it was something new for everybody, right? And
Sure.
certainly the healthcare environment was hit pretty hard with all of the needs and uh, implications thereof. And women and children, as you mentioned, are a vulnerable part of the society, and so they were impacted.
Yeah, how did the pandemic uniquely impact the health and well-being of women and children, specifically in the Midwest?
Yeah, so the Midwest is not unlike a lot of the other areas around it. And so I don't know if we're so unique in the Midwest, but just the closing, the isolation, the job loss with unpaid leave that hit women probably a little harder than men because of school and daycare closures that were there.
Mhm.
About 1 in 10 women really quit their job due to the pandemic or reasons for the pandemic. And so kids isolated from school, we found that there were some impacts to learning, but the school and daycare closings that went on really had a tremendous cost to society or to the United States to the tune of almost $122 billion. So pretty significant impact. We saw mental health issues go up for adolescents, and that's a problem that was on the rise before, but we saw some increased illness associated with that, a lot of depression and anxiety. And, the physical impact of the disease itself really, kids were not impacted usually as severely, but there were 5 times the number of hospitalizations in the Omicron variant, so that second variant that kind of came through, than what there was at the peak. And of those, 30 to 40% of those needed to be in an ICU setting. There were up to 3% of those kids ended up dying. And women who were pregnant, of course, high risk for this, really had a lot more challenges with comorbidities associated with that. So it was a very difficult time for those populations.
And what were some of the most pressing challenges that your team faced providing care?
Yeah, so it's really interesting because it was kind of a theme of not enough, right? We didn't have enough space, we didn't have enough staff, we didn't have enough workforce to, not just the caregiving staff, but all of the support staff, cleaning, services and those types of things. And, we all get sick too. And so when folks were down, that would add to or compound it with some very clear guidelines of when you could return to work or not return to work. And, how do we address the mental health impacts on those folks who were kind of at the front line? The supply issues with PPE, trying to get enough, that personal protective equipment so that you could feel safe going into these areas. There's a lot of fear around that and what would be the appropriate type of PPE to have and can we get it? And so maybe you'll remember that they even turned to folks for making cloth masks for a while. And we had a lot of folks in industry making hand sanitizer, right? So even some of the distilleries changed their processes.
Yeah, they did down here in Key West. Paul Menta and the distillery here, he turned all of the other stuff up and he produced hand sanitizer and gave it away.
Right. Yeah. So just and we weren't really immune to that really at all. And so the other thing that we were challenged to do was still provide access, right? So even though we had lots of ambulatory settings that were closed. You remember that we even shut down all elective surgeries, and that type of thing. But how do you keep access going for those other chronic illnesses where you need to see? And so how do you stand up telehealth services in a way that, we've been playing with a little bit, but we really didn't have a good platform to see lots of individuals with. So, yeah, there are lots of challenges, just how to treat it, how to communicate with folks. We ended up starting up a morning chat 3 times a week where clinicians and the clinical staff and all of our ambulatory sites could get on, and we would update with the most current information. Had a lot of conversations with some of the researchers at other institutions and looking at how we develop vaccine, understanding how there was spread, the transmission of the virus, and how do you treat this, right? What things go on. And so really the industry, the entire healthcare system struggled at assimilating all this information and then being consistent with how they would develop treatment plans and engage with folks.
Yeah. And what about, Tim, the staffing shortages and the burnout?
Well, Dave, how did you deal with that issue with, and I would assume it's continuing to exist now for staffing shortages. It was probably bad before.
Yeah.
What are you experiencing now there in the Midwest with you have how many hospitals?
We have 16 hospitals. We have about 16. Yep. And probably about 25,000 mission partners. And so, the staffing shortages were tough then, and they continue to be tough. During the pandemic, there were probably 100,000 nurses across the United States that quit.
Yeah, really.
100,000. 100,000.
Yes. And so, they're expecting about 600,000 almost to leave by 2007. And I don't have the specific numbers for us, but we were down and seeing significant turnover, not just in nurses, but also in some of the clinical spaces with NPs and PAs. And we fortunately were able to connect with those caregivers so that they would feel supported in some ways, but especially folks in the hospital setting, very difficult because putting people in halls and trying to develop isolation rooms and then thinking about, well, which patients need to go on a ventilator, and are we getting close to having, we even had developed plans around that, and that amount of stress on how we ration care really caused significant moral distress and a lot of difficulties with that. So we, not unlike other systems, really started to look for traveling nurses, right? Either from other areas and across the country, but even some international areas where nurses could come in and work. And so you would bring in these folks at a cost that was significantly higher.
Yes.
To be able to handle all of those issues. And so it was piecemeal for our staffing. Administrative folks who had a degree or could help out would go to the hospital and help out, or go to a clinic and help out, seeing patients or sweeping the floors or whatever. It was all hands on deck.
Yeah. To get done. Yeah. Wow.
Yeah. Well, I had just as a quick aside, one of my granddaughters was a CNA. I think that's what it's called. They're like they came in to just kind of help out with some of the stuff. She started just before the pandemic hit, and then she worked through that, and she saw a lot of things that were very much causing a mental issue. She has, however, gone in, and she's now almost finished with getting her nursing degree. So
Right.
she saw a lot of the bad stuff, but she said, you know what, I need to be in this field. So she'll graduate soon. So,
Super.
yeah. So
Yeah.
what other kinds of things have you had to do to be able to help, and assumingly that there is some continued staff burnout, some mental health concerns that you all
Absolutely.
have, that you're kind of in a unique position. How have you addressed some of those things in some unique ways?
Yeah. So, one of those, it's really been kind of on all facets of what employment looks like, in how do we address engagement in worker well-being, right? So in some of those clinical areas, really significant increases in some of the wage setting.
Mhm.
So you look at some of your support staff and they're paid a minimum wage, and the minimum wage was not enough to keep them in this unsafe environment,
Yeah.
around that. So I'm thinking of, some of your receptionists and other things that are there, but it took for a lot of the staffing to make sure that we were at or above market in our compensation strategies.
Okay.
We did a lot with retention bonuses as well. We've tried to become more flexible in some of the scheduling pieces of it, recognizing the work-life balance that is really, really important for women, especially as they're often left with some of the childcare responsibilities still. And so we have had lots of conversation around well-being, and have um, retreats or other types of things that talk about that. The sisters, we're a Catholic healthcare organization, so there's always been some mission integration type of work that's done on an annual basis, but we've taken that to the next level with some of the diversity, equity, and inclusion activities that are going on across the country, and making sure that we're creating that space for the workforce as well as for the patients that we're serving, and recognizing a lot of employee assistance, different types of benefits that would be available there, some rewards that maybe weren't there before for, patient care, patient engagement and satisfaction type things. And some education resource to, allow folks to advance their training and still stay engaged. So we've tried to hit that from a variety of areas, but it's difficult with the shortages. I talked about some of the shortages that we continue to see and project. So, retention is incredibly important, but then it's the recruitment piece as well, right? And so, just like your granddaughter who's going on, how do we help advance the skills, and then how do we go to those training programs and engage in relationships so we can get to a pipeline that makes sense?
Yeah, absolutely.
And
Now, are
yeah.
your hospitals, do they tend to be in rural areas, or where you might be a large employer in those typical areas, or
Yes.
is that not where you're located?
Yeah, well, we are still even in Peoria, probably where the headquarters is. It's
Okay.
almost a 700 bed trauma one center with a children's hospital, and it's very high acuity. And then we have some medium-sized hospitals where we provide pretty good levels of care, even some cardiology services, open heart surgeries services, even some neurosurgical services in some of those areas. But many of our 16 hospitals are small, rural, and some critical access hospitals. And so, it really is. And I think that's part of the reason we were, if you come together as a group, right, and you can share resource and you can shuttle the resource around, I think that made us more successful at making it through some of these things. So.
That's great.
Yeah, that's awesome. Yeah. So with some of the rising costs and the supply chain disruptions, really, and virtually every industry, right? Many of them still going on today.
Mhm.
how has the pandemic impacted the cost of providing care for women and children?
Yeah, so the spend, that first year kind of went down over the course of the year because people weren't accessing care in the ambulatory environment, and we hadn't done as many elective procedures. But the cost of that care, to deliver that care, has continued to go up. So, we had a couple years ago, the first time in the 144-year history where we had a negative margin. We were able to work through that, and we're back on track. Healthcare systems are finding that there's some improvement in margins. Some are still operating at a loss, and some are more break even. But finding places that well, the inflationary costs have been incredibly high. Medications, the PPE as well, in addition to all the technology that needs to be, things cycle, right? You get a CT scan that's end of life and you still have to invest. And so that's where those margins become really important, even though we're a nonprofit industry. You gotta be able to continue to provide those services. And so we've seen all of those things increase in cost, but by and large, traveling nurses and locum tenens physicians, people who come in, they work for a stint and then they leave, was driving the largest bit of cost.
So the contingent labor.
Yeah, the contingent labor force was, you really need them. They're great clinicians, but boy, getting to the point where you can shut that off a little bit has really made the difference in our ability to handle those costs.
So can you describe any of the specific supply chain challenges that you encountered, and then how did you work from? I mean, one of them may be just what we were talking about, the contingent labor.
Yeah.
To overcome them. And there was so much competition for those traveling nurses. I mean, how did they select to come to you?
Well, it largely becomes what will you pay, right? So going rate for nurse, you were getting to the $200 plus an hour rate in paying for these folks to come in. And so if you had 10 or 15%, sometimes even more, of travelers in your workforce, that was a big hit to the bottom line. But we really struggled with some of the other necessary things, the appropriate PPE, right? So if you just remember the masks that we had, the N95 masks, but then there were these pappers that kind of a shield over your face for guys that would have a beard and that kind of thing. We struggled. We had supply chain ended up exploring international as well as national companies. We were looking for other partners who would come on board and do help manufacture some things, but we wanted to maintain a quality that was appropriate for those things as well. And so even things like electronic leads for scalp monitoring for women who are in labor, if you're not getting a good recording with that belt they put on to monitor the fetal heart rate, well, you try and get to some cost containment by using a specific vendor. But if that vendor then has a problem with production for that, and we see this in medications a lot, right? So we've seen more drug shortages across the country than what we've seen in the past. And but those are the types of things where, do you have some different equipment? Is there a different vendor? And what would the true protocol be with using less of certain types of medications? And how are you going to triage that, right? So which patient population is going to get that over others that may need the same medication? And those are always incredibly difficult.
Yeah, so difficult and ethical and everything you've got to challenge
yeah.
yourself with.
Yeah,
I can imagine.
yeah.
And so many people competing for the same goods, right?
Yes.
All at the same time. And let's say a lot of that PPE is made in China or Taiwan,
Yeah.
Indonesia, and, you know, with supplies coming back and forth, that was a real challenge. Did you have to make any difficult decisions regarding resource allocation due to rising costs?
We have. In fact, some of the resource allocation becomes on what types of services can we deliver where. So it's a quality safety concern, right? And that you want to be able to provide enough of a service so that you're really good at it. So that's one aspect of it. But the other aspect of it, like birthing centers or birthing units in hospitals across the country, we're seeing them close. And we're seeing them close in critical access areas or rural areas, especially because one, the volume is not that big and you can't drive margin and you can't afford to lose in an already fiscally challenged environment. So unfortunately, we have made some decisions about which hospitals we will or will not deliver babies at, and actually have closed a couple of our birthing centers and hospitals, and you know, now working to figure out how we manage the pre and postnatal care needs of those and make sure the transportation and availability for birthing is appropriate.
Yeah,
Yeah,
that's gotta be a huge
difficult.
change.
Yeah, big change, and for the people in those communities as well.
Huge. Yeah, we're sometimes not very popular with those changes, you know.
Yeah. It's an
Yeah.
interesting dilemma to go through when you're providing services like that and are critical and you simply can't.
Yes.
Yeah, that's right.
So what kind of priorities do you have to help rebuild and strengthen the services? Just kind of what you were talking about.
Yeah. So
Now,
you know,
like for example, have reimbursements changed for you? Have they increased?
yeah, well, we have certainly we talk with our insured populations and the types of folks that are there, and we work with our managed Medicaid and Medicare Advantage programs as much as possible. We've really focused on making sure that the quality and the targets that are met are met, so that we don't leave potential money on the table, right? So if you're going to be paid for a certain level of quality, and if you don't quite meet some of those parameters, shame on you, because then you've left money on the table. And so, you know, we've really focused on the value-based care approach to some of the reimbursement pieces of it. You
That's
know,
got to be challenging. Yeah, no doubt.
yeah, it really is. We're looking at the access issue because we cover a large swath of central Illinois and have one hospital up in the northern Michigan region. We are interested in providing as much care close to home as we can, and providing care in different spaces and different places. So, you know, how can we make some of the virtual visits that we were using during the pandemic effective and applicable for different patient populations, even doing some things that we didn't think we would necessarily do before. We've been pretty aggressive at looking at how we partner with some of the Medicaid population in the state of Illinois for providing some of those prenatal services we were talking about, as well as the postpartum services and lactation needs that come later on. So taking some of those ambulatory visits and making them virtual, and providing then a place where, you know, a pregnant patient can call anytime and have a conversation with a nurse or a healthcare provider is been an important part of that. And so, you know, it's also created an opportunity for us to look at our other care models as well, and how can we be innovative and supportive in ways that we haven't always been in the past. And so our strategy really is, you know, been around what can you what can we do differently? Where's the intersection of costs and access and maintaining equality and a safety with the types of interventions that are there. People love being able to have access to their own chart in the apps on their phone. They love being able to text back and forth with the healthcare team. And so we're actively engaged in a lot of those types of arenas.
Yeah, and I think, don't you find that this kind of post-pandemic that more people are willing to undertake a virtual conversation with their healthcare practitioner in ways that they wouldn't have just a few years ago?
Absolutely. It's interesting. We've started a new cancer, or we just built a new cancer center with a proton beam. It's really all high tech. And they were looking at, how do we provide navigation services? And so they did this survey on who is the most important team member when they have cancer. So there were focus groups and things, and who do you trust when you're having questions? And it was really your primary care team. So it was the folks you've known for a long time that are there that they still go to first. And so it created a perspective for us that, it's not just getting something virtually, but they want something virtually with their provider that they've known, they've chosen, they've trusted in that way. And they don't want to necessarily lose that as some of the illness becomes more complex and a lot of more specialties. And boy, then that's where the confusion is, right? Because now we're trying to navigate something that I, as a healthcare professional and a physician for a lot of years, have trouble navigating myself at times because we haven't made it easy. And so, I think there's hope in those types of things. And
so it is in the relationship as well, right? That you're just saying, you're kind of finding out that where there's comfort in the relationship, there's the ability perhaps even to deliver services faster, better, more comprehensive to the individual.
right.
So based on that, as you look around from the Midwest perspective and your long time in the business, what gives you hope now in this post-pandemic era in the healthcare industry? As you look about services for women and children that you deal with?
I think that the idea that the pandemic really put front and center some of the disparities in care for vulnerable populations, and being the pediatrician involved with women and children's services, I see that now in ways that I didn't necessarily see that before with some of the environmental and social influences that are there. And so I think just beginning to have some of that conversation becomes really important, and how we care for people and how we engage in that patient population. I think again that the innovation around how we deliver care, right? So can we do this differently? Can we do it more conveniently? Can we bring virtual can we bring other specialists in the room virtually for some of our folks with real chronic illness? So some of our special needs patients who have a lot of medical equipment needs, getting out and taking them to a variety of visits becomes a real challenge.
Yes.
And can we coordinate that at a time where we bring other folks in who can virtually, important members of the team for the multi-system disease that might be going on, or the impacts of that? And can we do it in a way that's more convenient for the family's needs, and minimize the travel and disruptions in those ways? And so
I think that would be so helpful to people.
Really, yeah.
Coordinate those things, because boy, you see people all the time. They got doctor's appointments every other day or every third day, and they've got to keep traveling back and forth.
Yeah.
So I think that'd be a great innovation.
It sure will.
Yep.
Well, thank you, Dr. Duffy, for sharing your insights and expertise with us today. Your dedication to women and children's health is just truly inspiring. We'll be back soon with another episode exploring the intersection of talent, strategy, and healthcare.
Yeah. Yeah, and we will with Dr. Duffy. It should come out in a week or so. So we've had a great discussion. And for those of you listening to us, we always ask if you've got those tough people challenges and you want to achieve a strategic business growth, tap into our expertise in talent optimization, leadership development, mental fitness coaching. And for actionable insights, subscribe to and like our Talent Talk and Strategy Stroll podcast on Spotify or wherever you have a chance to listen to those podcasts. Contact us when you can. Let us help you transform your talent and achieving lasting results. You can always reach me at 816-522-4777 or Mayor at 727-260-2085 or on LinkedIn. So until this next episode, I'm Tim Stockwell, my sister Mary, and of course our great guest, Dr. David Duffy. So we'll see you guys on the beach.
Thanks. That's a wrap. Great job.